Hi everyone, Dr. Nemechek here. I want to just touch base with, people will kind of panic when their child's doing worse. You're on the protocol and suddenly your child's doing worse and they think they're relapsing. Now, relapsing is a loaded word. It implies like things are at this kind of cellular level, everything's getting worse again. And if you're on our protocol, that does not happen. All right? Let me just explain. So, if you do use the word relapse in medicine, like we don't say somebody with diabetes had a relapse, for instance, okay, or somebody with asthma had a relapse. Relapse applies to something that it's autonomous, almost have a life of its own. And things you would think of are active cancer, autoimmune disorders, and then disorders involving microorganisms. So in the case of a virus relapsing and causing shingles, or the bacterial overgrowth in the small intestine, okay? That doesn't apply to autism or developmental delay. People often use this word, and again, my point here is the child's brain is not getting worse, even though the behaviors might be worse, okay? This is not a relapse. What this is, and this often when you see more aggression, hyperactivity, decreased focus, attention, they are not worse at the cellular level. This is due to a variety of factors you have to look for, okay? It can be an increase of inflammation, so loss of control of SIBO, so maybe the inulin fails and you've got to switch to rifaximin. You get COVID, and so you got to treat that with some glutamine afterwards. You got a dental abscess infection actually creating inflammation, or you could have dental pain from just teeth that are erupting. The baby teeth are coming out. A molar coming in, the pressure and pain of the second, especially the third molars, okay? And then when the parents are unaware, I was tightening the braces. And you can have ear infections, worsening constipation, or just problems at home, or at school, like change of teacher, bad teacher, parents are separated, something like that. All right? Now, here's just a quick list of things to do. All right. So if I have a kid generally improving, except for one or two kind of things that are slow compared to everything else, here's my list. I go through with the parents. Dosing, add VNS, maybe switch from inulin to a form of rifaximin, or monthly to continuous rifaximin, add inulin or PHGG, 6 weeks of glutamine, maybe add an pyridostigmine. Steps 2 through 4, the greatest chance of improving progress. Okay, those are the ones you go to first. If you have no improvement overall, steps 3 through 6 are the ones you look at. All right? Okay, that's all for today. Everybody hit the subscribe button and keep up the good work. Bye.